You're not tired, but your face is telling everyone you are. And that disconnect is exactly why so many people feel frustrated when they look in the mirror. What's also annoying is having to hear from people you meet asking you, why are you tired? When in reality, you're not feeling tired. You're feeling like yourself. But it can be irritating having to tell someone you're not. One of the most common reasons why people think you're tired is the way your eyes look, specifically the under eye area. And it's not just dark circles, it's the way light hits your face. When the under eye area is smooth and supported, light reflects evenly. You look bright, awake, rested. But when that support starts to change, that smoothness and brightness goes away. It creates a shadow, and that shadow makes you look exhausted, even when you're not. There's a natural transition from your lower eyelid to your cheek. When you're younger, it's smooth and seamless. But over time, this natural transition starts to separate. The cheek drops slightly, the under eye loses support, and now there's a visible dip, like a small groove running across your face. Light hits that groove and creates darkness, not because your skin is darker, but because the shadow is deeper. That hollow doesn't come from thin skin alone, it comes from imbalance in your lower eye and cheek contour. Furthermore, either due to genetics or aging, the fat under your eye may start to protrude more and create an undesirable hill or bag look that further detracts from a desirable smooth contour. So, you're not tired, you're losing structure, and you might have some pseudo herniation of the under eye fat. If the predominant issue causing the dark circles is a volume loss issue, then careful placement of filler to the tear troughs can definitely help. The goal is to restore that ideal youthful lid-cheek junction. But tear trough injections are extremely challenging procedures. You must go to an experienced injector. Not only is this area very unforgiving, but there's a very rare risk of going blind in the eye. This is a major catastrophic complication. This is why, if you're going to get tear trough fillers, you must go to someone with experience injecting this area. I tell all my patients that my goal is to correct the area to 80 to 90% correction. The reason is setting the right expectations at the beginning. As I mentioned earlier, this is an unforgiving area. I can try to shoot for 100% correction, but if I overshoot by just a tiny bit, correcting this is not easy. This is because while injecting a product is very precise, erasing any overfilled areas is not. We have agents like hyaluronidase that can dissolve fillers, but it's not like using an eraser to finally erase any minute errors. Once you inject hyaluronidase, I can't control how much of the filler gets dissolved. You start to chase your tail if you go down this road. Better to set the expectations up front, that we are not going for 100% correction. Because our face doesn't age in simple linear fashion, other things may also be going on that can contribute to this hollowness and shadow effect. While the tear trough deformity is the most obvious noticeable thing you see, often your cheeks have also lost some support. Sometimes adding some support to your cheeks will also help improving your entire look. That is why seeing someone with expertise and experience in facial aging is so important. Only by examining you can I determine if you need cheek support. In my experience, many patients will benefit from cheek support, but at the same time, correcting this area is more to enhance your results. In many cases, the tear troughs are the most noticeable deformity, and correcting that alone will give good results. Adding fillers to support or lift the cheeks will usually enhance the results. If I had to choose between the two, I would definitely recommend tear trough fillers. Finally, if you have significant fat pseudo herniation, that is something that is best addressed with surgery. But even in patients who refuse surgery, the above principles using fillers can still help. Regardless of what's causing your tired look, the goal is to create a smooth transition again. So when light hits your face, it reflects evenly instead of falling into a shadow. You look like you finally got rest, and people stop bugging you asking you why you look so tired. If you want a natural result that actually makes you look refreshed, not puffy or artificial, then you need the right strategy from the start. You can schedule a consultation and I'll walk you through exactly what your face needs and how to fix it the right way.